Well, I guess we'll go ahead and get started. So good evening, everyone. My name is Albert Whitaker, and I am the Director for Community Impact for the American Heart Association. And I'd like to welcome you here this evening for a conversation around mental health and what impact that has on hypertension. And so we are excited to have a great group that is going to share with you insight. And first of all, I'd like to welcome Dr. Greg Stone Yearwood. And he is the primary specialist with Landmark Medical Center. So Dr. Yearwood.
Yes, it's an honor to be here among such distinguished people. We are concerned about mental health, but also we are concerned about cardiovascular disease. And it is certainly a leading cause of death and morbidity and mortality in this country and in the whole world. So today we're going to have some special people. Mostly we're going to have someone who's been in the field for at least 30 years in the form of Dr. Karen Aspirin. And she is going to be really getting into this and helping us to really improve our health mentally and physically, and decrease, because they are reversible causes, so we don't all have to crash from this disease. So we are going to learn how we can protect ourselves. So we are so happy that people can join in and learn today, and we're looking forward to a healthy, good discussion conversation. So Dr. Karen Aspirin, she is a board certified, is a cardiologist who has been practicing for about 30 years. She's associated with the South County, from what we have seen. Also, she's a Lifespan Cardiovascular Institute member and a member of the Southern New England American Heart Association Board of Directors. So we're honored to have you, and welcome.
Thank you. Thank you, Greg, and thank you, Albert, and thanks everybody, Andrea, and all the AHA people, and everybody who's joined this lecture, this virtual lecture today. And we are going to be talking today in the area and sphere of heart disease prevention, and essentially how to empower ourselves and our communities to achieve better cardiovascular health. I'm going to define that, as well as health equity, which is a newer concept that's been really recognized and discussed just in the last few years, and particularly in the face of the pandemic, which brought a lot of realization into this problem. Next slide. Why do we need to focus and talk about cardiovascular health? Obviously, everyone, I think, knows that it's the #1 killer of Americans. And despite a 50% decline in cardiovascular death rates in the US over the past 4 decades, in the last 5 years, cardiovascular death rates are actually on the rise. That's unfortunately probably the result of the obesity epidemic and all of the other risk factors that it has spawned. Now, we have recognized in the last several decades that achieving a group of cardiovascular health factors called Life Simple 7, and we'll define these a little bit later, can actually reverse this trend and improve cardiovascular health in individuals and the population. Unfortunately, levels of these risk factors and health factors are actually worse in some minority groups, and this has driven what we now call health inequity. It's negatively impacted health equity. And what is health equity? And that is essentially similar outcomes in all ethnic groups across the spectrum in the US, but as you will see, we have some inequity that's been apparent for some time. And we believe that this has become a major factor that we need to focus on. So what we know is cardiovascular health and health equity can be improved by better personal adherence to Life Simple 7, and we're going to go through that, as well as better health policies, both at the federal level, state level, and in communities. But a greater focus on the social determinants of health and the mind-heart-body connection the AHA has now recognized is also needed. Next slide. Now, what are social determinants of health? Well, this slide sort of shows you these 5 spheres of social determinants of health. It includes everything from where we live, community in our neighborhood, how easy it is for us to get healthcare, our education level, and our economic stability within our personal and family sphere. As it turns out, where we live, our neighborhoods and communities predict actually 80% of our heart health. That's because they impact our access to healthy food, safe exercise, community and faith-based connections, and clean air. So, you know, where we live, our zip code actually means the most in terms of our health outcomes. However, other social determinants are important. They include our education, economic stability, and healthcare access. Next slide. Now, we know that if your social determinants of health are adverse or unfavorable, this does raise heart risks in some poor and minority groups. And we're going to focus on this. We found that African Americans, Native Hawaiians, and Latinx Americans are more likely to live in communities with lower access to healthy food, so-called food deserts, and also less access to safe exercise. We have now linked this to more hypertension and diabetes and to cardiovascular disease. Similarly, LGBTQ individuals, we now know are at increased risk of mental health conditions related to their stigma, leading to higher rates of smoking and other unhealthy behaviors, and also to cardiovascular disease. And in a broader sense, racism and poverty in general are now known to spawn chronic stress. They also limit access to regular medical care and access to medications to reduce cardiovascular conditions. So these worsen cardiovascular risk factors and then also cardiovascular outcomes. So it's really important to recognize that these social determinants of health are really the root cause of much of the health, cardiovascular health inequity that we're now seeing in disparities that we're now seeing in the population. Next slide. We also know that social determinants of health also impact important mind, body, and heart connections. This slide sort of looks at this and it can be in a favorable or unfavorable way. So if you have favorable social determinants of health based on those 5 spheres that we showed a couple of slides ago, then you're more likely to experience feelings of calm, happiness, well-being, connectiveness, and purpose in life. On the other hand, if you have unfavorable or adverse social determinants of health, you're more likely to experience chronic stress, anxiety, depression, pessimism, isolation, and hostility. All of these drive in the mind feelings that can change our biology, and we're going to talk about this, and also negatively impact our behaviors, how well we adhere to healthy lifestyles and to medications. So social determinants obviously can favorably affect our mind, our mental health, in turn, through changes in biology, affect our body, and then also changes in which then are transferred to the heart, and also affect our behaviors and how well we stick to healthy lifestyles. So this is really important. Social determinants, root cause, and they also negatively or positively impact mind, heart, body connections. Next slide. So let's do a little deeper dive into these mind, body, heart connections here in this slide and the next. So what do we know? We know that negative mindsets, feeling of poor mental health, or having any of those feelings that we just discussed, chronic stress, anxiety, isolation, pessimism, these trigger, in many cases, our autonomic nervous system. In the case of stress and anxiety, they can trigger a fight or flight response. Now, if you have to run out of a burning building, that's a good thing. But over the chronic sort of time frame of one's life or decades, this has adverse effects in the body because of the chronic increased levels of the hormones cortisol and adrenaline. These raise our heart rates, our blood pressure, and cause stress in our heart and our blood vessels. They also lead to spasm, coronary vasospasm. That's why someone who's extremely anxious acutely can have an acute heart attack. They've also been linked to blood clotting. So these are not good things to have on a chronic basis. Prolonged stress also increases inflammation, lowers our immune response. We now know that many cardiovascular events, acute cardiovascular events, are due to increased inflammation, vascular inflammation. Next. So these also drive unhealthy behaviors. How this works: depression and anxiety can lead to lower amounts of exercise, poor diet, more smoking. These risk factors and the physiologic effects raise heart disease risk. And then in a circular way, heart disease risk can further worsen depression and anxiety. So there's a domino effect, but then there's also a cascading and circular effect where all of these amplify once you have heart disease. Next slide. Now, on the flip side, we know from data of individuals who don't express any of these adverse negative emotions and have a greater sense of purpose, they have better heart health, live longer, essentially. So optimism and positivity have been shown to actually decrease other things like the rate of cardiovascular disease progression, the rate of acute events, et cetera. So good mental health and good feelings can actually are cardioprotective. Next slide. And just like on the flip side of negative impacts on health behavior, good mental health also improve health behaviors and adherence to healthy lifestyles and medications. So a better mood and feelings of well-being improve or adherence to exercise, healthy eating, stopping smoking, and even getting better sleep. And then these in turn dramatically reduce the risk of heart disease. And also, these things can also boost our mood and well-being. As you know, exercise can release endorphins and make you feel better. So again, this is it's a domino effect, but in a positive way, and it also circles back to reinforce the better mood. Next slide. So what actually works for improving, what's evidence-based, as we say in medicine, as Dr. Yar would agree, we're always looking for the evidence-based sort of approach to reach for our patients. And the American Heart Association has been really dedicated to uncovering this. They put out a scientific statement. I'm sorry, that's to be March 2021. I don't know how 2015 got in there, but essentially that's a typo. This was just this year. Psychological health, well-being in the mind, heart-body connection. And they looked at all the data. And what they found is that it's actually a mindset shift. Practicing positivity and daily healthy habits, you can almost train yourself when you get up in the morning. If you feel lousy, to look outside and say, you know what, I'm actually pretty lucky. I actually should be thankful for where I am and that I'm not sick and in the hospital, and to find small nuggets of your life that you can be thankful for. That kind of gratitude, even like another study where you just smile more, can boost your mood. So it's a shift in mindset. It's not a one-time boost. So, you can't go just see a stand-up comic and feel like, you're going to improve your psychological health for the long term. So a funny movie or something like that may help for a day or so, but it's not a long-term sort of thing. And then what we have looked at is medications. So there are some medications that can help depression, improve outcomes, help better adherence to medications and lifestyles. Therapy, cognitive behavioral therapy, also has been shown to improve your negative emotions and reverse them. And meditation is one thing that also has been shown in some studies to have actual clinical effects on blood pressure. So the bottom line is not a lot of data, it's emerging, but these are the things that we can hang our hat on if we want to improve our health behaviors and health cardiac or heart health outcomes. Next slide. So let's move on in the behavior sort of sphere or realm here and talk about Life Simple 7, because most of them are behaviors, and look at these factors, which the American Heart Association has been focused on, next slide, for about a decade now, since 2010. In their 2010 impact statement, they came out with a list of 7 behaviors and metabolic factors that really provide a roadmap to ideal cardiovascular health. And they actually defined ideal cardiovascular health. On the one hand, if you smoke, if you sit and you're sedentary, if you have toxic food habits, you're overweight, you have poorly treated dyslipidemia or hypertension, prediabetes, you're on the road to cardiovascular disease and premature death. Study after study after study has shown this. On the other hand, if you look at the lower road and you are a non-smoker, you exercise on a regular basis, you eat a healthy diet, you have a normal BMI, normal cholesterol, normal blood pressure, and no diabetes, these individuals, and hopefully some of us, are going to be on the road to absence of cardiovascular disease or ideal cardiovascular health and longevity. Doesn't mean we won't ever have a heart event, but it'll be pushed way, way off into the future, maybe when we're much, much older. Next slide. Now, Life Simple 7 has been put to the test. Most studies that have published cohort studies in the US and globally that have published outcomes data for what works in terms of reducing risk of heart disease have looked at their data and subjected it to the Life Simple 7 metrics there. And what we've come up with is that if you adhere to all 7 measures, you have about 1/10 the rate of a heart attack or stroke. You have lower rates of subclinical atherosclerosis, lower rates of death from all causes, low rates of kidney disease, retinopathy, and cognitive decline or dementia, greater health in old age, and greater longevity. So Life Simple 7 is really a magic formula. Unfortunately, less than 1% of Americans actually have achieved Life Simple 7, sort of like a nirvana state, if you will. And many, many individuals in minority communities have lower achievement or metrics in these Life Simple 7 measures. So I want to go through these now and talk about the why and how of achieving these. Next slide. The first and most obvious thing to all of us on this call is that we want to avoid smoking and vaping. Not smoking predicts cardiovascular health, while smoking is the #1 cause of early heart attacks. Why? Nicotine and carbon monoxide and all the other hundreds of chemicals in cigarette smoke directly injure blood vessels and cause body inflammation. Unfortunately, about 15% of Americans still smoke, and poor rural white individuals, particularly younger individuals in that demographic, about half of younger, poor, rural white individuals are smoking. So we really, really want to be making sure that we talk to our friends and families about not smoking. What is most successful in quitting is to focus on what would motivate you to stay around. For most of us, it's our family. It may be our children, it may be grandchildren. So that should be a reason for quitting. You want to set a quit date, discuss the medications that may help with your primary care provider. You can get phone support, really important, from governmental sources, 1-800-QUIT-NOW, or tech support from smokefree.gov. And they send you these free texts, and my patients have found these to be very useful. And if you fail and relapse, then of course you just get up and try again. Eventually you will succeed. Next slide. The second is to eat a healthy diet. Why? A healthy diet high in these components, fruits, fresh or frozen, vegetables, grains, and fish, predicts heart health. On the other hand, a processed diet high in nutrient poor foods and sodium, added sugars, and saturated fat is now the #1 cause of early disability and death in the US, based on the global and US burden of disease collaborators. So they actually analyze and model the causes of death in the population. Dietary risk, number one. Unfortunately, of all of the Life Simple 7 factors, a healthy diet has the lowest adherence across the board. How can we improve this? Well, this little graphic is the USDA's My Plate model. And the very simple thing you can do, and all of us can do, is make half that plate fruits and vegetables at every meal. And you can use fresh and frozen. They're equally good. Canned, not so much, because they're usually high in sodium. A quarter of that plate, you want it to be whole grains. It could be plain Cheerios or oatmeal in the morning, whole grain bread in the afternoon, brown rice in the evening. You could also do fiber-rich carbs like sweet potatoes and squash. That's also going to give you that fiber-rich quarter of the plate. And the other quarter of the plate, healthy proteins. What we know is that beans, legumes, lentils, nuts, and fish are really the ones associated with less or no signal of harm and a signal of benefit for cardiovascular health. So you want to eat mostly those, and your food bill will also plummet if you practice that. You want to eat fat-free and low-fat dairy products for additional protein and calcium, but you can also do soy milk for those who choose not to eat dairy. Really what you want to avoid is the red and processed meats, foods and beverages high in added sugar. That would be sugary beverages. Just switch them out to diet or make other alternatives. And also foods high in sodium and saturated fat. All of these have been associated with signals of harm in diet studies looking at cardiovascular outcomes. It's really, really important for us to try to move the needle on diet in the population. Okay, next slide. Physical activity, so important. Regular activity predicts heart health and longevity. There's actually no behavior that does more for improving the likelihood that we're going to live longer and we can reverse aging either than exercise. It improves the blood cholesterol, blood pressure, blood sugar, inflammation, stamina, and mood as well. So again, another one of those things that's circling back to improve our mental mindset. Unfortunately, less than 2 in 10 Americans report adequate exercise. So what do you want to do? You want to just start with even the small amount. If you look at all the studies, the biggest benefit were from people who were sitting on the couch and then got up to do any kind of exercise. They had the most benefit in terms of the magnitude of benefit from exercise on cardiovascular outcomes and mortality. You want to work up to 30 minutes, 7 days a week. Choose activities you enjoy, but if you want to do something vigorous and you're over 40, you probably want to check with your doctor to make sure that your heart is healthy enough for that. And then data have shown that using wearables like pedometers to track our progress is also evidence-based, and in short-term studies have improved adherence to physical activity. So spend no more than about $20 and get a pedometer if you can. Okay, next slide. Improve body weight. Why? BMI of less than 25 predicts cardiovascular health. Overweight raises the risk of diabetes, high blood pressure, abnormal cholesterol, and inflammation. Unfortunately, overweight or obesity now affect about 60% of us. So you have to take action here as well. You want to simply reduce your calories, eliminate added sugars. I see so many patients who come in and they're eating sugary beverages. They just stop doing that and their body weight plummets, particularly the body weight around their waist. Avoid fad diets though. Make sure the diet isn't a fancy diet that's causing you to eat a lot of fat or no carbs, because that isn't associated with heart health either. Know your ideal body weight and set a weight loss goal. Track your progress via regular, daily, if possible, self-weighing. And then the other part of the closing the loop is to get feedback. You can't usually see your primary doctor every week, but you can get an in-person or online coach or use a diet app that uses behavioral techniques to give you that instant, at least weekly support and feedback and follow up on how you're doing towards achieving your goal. Next slide. Blood pressure, so important. Why? A normal blood pressure of 120/80 predicts ideal cardiovascular health. And high blood pressure is the most important cardiovascular risk factor, usually mediated through stroke. Higher blood pressure stiffens blood pressures in the heart muscle, and of course is the #1 risk factor for stroke. 1 out of every 3 Americans has high blood pressure, and the prevalence is actually higher in African Americans. How can you take action? Know what a healthy blood pressure is. It changed in 2017 with a new AHA-ACC guideline. Now we're shooting for 120/80 or less. Track your readings at home, at your local pharmacy, or in office visits. Take medications if they're prescribed for you, and you want to follow a diet called the DASH diet, which stands for Dietary Approaches to Stop Hypertension. It's similarly, like we said, it is like the My Plate model. It's high in fruits and vegetables, low in red meat, and has a high in whole grains, as well as calcium containing foods. Next slide. And importantly, in my world, controlling blood cholesterol is so important. A normal LDL cholesterol, if you look at population studies across the globe, if you get that LDL under 100, that predicts freedom from cardiovascular disease or cardiovascular health. On the other hand, high cholesterol is a major driver of atherosclerosis, heart attack, and thrombotic strokes. About 40% of Americans have high cholesterol. I will say that the cholesterol level in the US has dropped in the last 2 decades, since most individuals who have high cholesterol are now being treated. Take action, know what the number should be, LDL under 100. If you have heart disease, we actually like it to be under 70. Track your readings on your health portal, or just ask the lab to send you your results. Consider a statin medication if you have high cholesterol, or this is new with the AHA-ACC guideline that came out in 2018. If you have a family history of early heart disease, you can talk to your doctor about taking a statin medication. And of course, if you have heart disease, a personal history, you want to take a statin medication. And then for dietary approaches to lowering cholesterol, you really want to hone in on the saturated fat, beef, butter, pork, cheese. Those things should be eliminated, reduced, and you want to increase your dietary fiber. Lastly, blood sugar. Why is this important? A normal blood glucose predicts, again, cardiovascular health, gives us one more metric towards our ideal cardiovascular health. High blood sugar, more than 125, predicts or is equivalent to diabetes, and that raises the risk of heart attack and stroke. Unfortunately, about 35% of Americans now have prediabetes, about 15% have diabetes. So you want to track these readings, eliminate all the foods and beverages with added sugar. Get your body weight down, increase dietary fiber and exercise. In the diabetes prevention trial, this was a major intervention that showed that you could reverse diabetes by essentially exercising and eating more dietary fiber. And then you want to consider early medical treatment with metformin or some of these other meds, if recommended by your health provider. And for diabetics, it's really, really important, more than anything, to not just control your blood sugar, but to control that blood pressure and cholesterol as well. That improves outcomes tremendously. So in summary, social determinants of health, we now know, impact our health behaviors and metabolic risk factors that have been linked to heart health. And the American Heart Association has been working tirelessly really to improve social determinants of health. So we started to recognize this in the last decade, but more so, I would have to say, since the pandemic, investing in science-based solutions to end health inequities, launching nationwide blood pressure initiatives for underserved groups in partnership with the Department of Health and Human Services, helping employers identify and dismantle structural racism in the workplace, improving access to quality care in underserved and rural communities, and creating new knowledge through these statements that are looking at all the evidence to put out there in the medical realm, so we know how to translate new data to our patients, and then investing in local entrepreneurs who are breaking down social and economic barriers to health equity. Social determinants, as we talked about, also impact important mind, body, and heart connections. really important, whether it's good or bad, social determinants of health are going to be impacting this important axis, mind, body, heart. So improving optimism and gratitude is an important sort of way, well-being, recognizing it's not just absence of disease, it's about really creating this healthier, happier, more fulfilling life, no matter where we are and what our social determinants are, and making small changes. Next slide. So how will you start improving your heart health? This is a slide from the AHA. You want to obviously do simple things like get good sleep, get fresh air, and move your body. Mention mental health to your doc, you know, because doctors have these screening forms, and I'm blanking on the word, sort of instruments that now are in most of the electronic records, and they can, you know, actually, and are supposed to ask you things about if you're depressed. These are part of meaningful use criteria that doctors have to sort of embark upon. And if you're not feeling well mentally, you really want to mention it to your doctor or healthcare provider. And as I said, do small things. Think of the things that you're grateful for. It may be just that you're not hospitalized, you don't have anything chronically, that you're ill, and your family as well. You should be grateful for that. That sense of gratefulness will actually improve your emotions and improve your heart health, improve your biology. Eat well. Make sure that you're snacking and eating healthy foods. It does not cost a lot of money. Plant-based diets are actually very economically beneficial for most people, because animal protein is actually expensive. So you do want to be making sure you're doing the basic fundamental thing of eating a healthy diet. Finding a way to help others also can give us a sense of personal satisfaction and purpose that can, again, help our change negative emotions to a more positive mindset. I would say this little one of taking 3 mindful breaths, this is important, and make sure that there's no cigarette smoke in those breaths. Okay, with that, I think we are done. So we certainly want to open it up and have anybody on the call put out any questions to us. I don't know if we're doing this in a chat format or if people want to just verbalize. I don't see any chats right here. If there's anybody on the call who has questions, you just want to verbalize it, throw it out there, happy to answer. So please enter any questions in the chat or take yourselves off mute, and we'll be happy to answer any.
I guess a
Are we
question
automatically?
Oh, go ahead. Mhm.
Go on. I just want to know if we are on mute or not. So I guess we are not all on mute. So continue.
No, I just wanted to ask a question. I know that there has been recently in the news some talk about low dose aspirin that was a regular regimen for people who were living with high blood pressure. And what are your thoughts on that, or what has the science said about that?
Yeah,
recently?
Albert, that's a really, really good question, because since that got out there in the media, and by the way, that was the U.S. Preventive Services Task Force. They were just looking at all the data, but these studies actually resulted more than 2 to 3 years ago. These larger randomized trials now with 45,000 sort of people and made analyses. And what they showed is that aspirin actually, as we know, reduces risk of heart attack and stroke. But people who take aspirin also have a higher risk of stomach bleeding. So there's a sort of risk-benefit analysis that needs to happen. And it wasn't really sort of, in the media, it was sort of put out there as, okay, stop aspirin if you're doing it for primary prevention, meaning you haven't had a heart attack or stroke. But really it comes down to the doc or the provider has to do the hard work. They need to really sit down and say, what are your personal risks? If I have a patient who has, lots of risk factors, and maybe many people in their family have had heart attacks, and they have never had stomach bleeding or gastritis, I tell them, and they're on aspirin, I don't take them off. I tell them to continue on aspirin. They don't need to take it every single day. They should always take it with food, coated, etc. So I sort of look at it as an individual approach. Obviously, if you've had a stroke or heart attack, or if you have atherosclerosis, like you had your doctor ordered a carotid scan and it showed plaque carotids, or a coronary calcium score that was positive, you should take aspirin unless there are contraindications like you were admitted, or you've had stomach bleeding. I hope that answers that.
Thank you.
I just follow up. Beside gastritis, are there any other GI symptoms that people?
Well, peptic ulcer disease. Some people, if they experience GI upset, usually I'll tell them to stop it or to reduce the amount. As as most of the docs on this call know, just one aspirin a day inhibits your platelets that are, your current generation of platelets for 10 days. Every day your bone marrow is, sending out new platelets. So by the 10th day, if you haven't taken any more aspirin, there's no more in the system. But if you have GI issues, and every time you take the aspirin, you get stomach upset, and you've never had a heart attack, stroke, and you have no vascular disease, then I would say, okay, stop the aspirin.
There's a question in the chat that says, what are some of the foods that are high in saturated fats?
Oh, very good question. My favorite topic. So we know that saturated fat, not cholesterol, dietary saturated fat, that drives up our LDL or bad cholesterol levels. And so what are these foods? It's important to recognize that there's a wide spectrum. It's usually in some beef fat, pork fat, butter fat, full fat dairy products, but then also in a plant-based source that's kind of become popular, but people shouldn't eat it, and that is coconut fat or coconut oil, tropical oils, palm oil, coconut oil. All you have to do is look at the American Heart Association 2017. You can go, anybody can look this up, by the way. Just go to Google Scholar. That gets you into the PubMed, or go directly to PubMed, which is all science, and look at the AHA 2017 statement on dietary fats. And they talked about coconut fat. These were experts in the field of dietary fats, not being a recommended fat to ingest because it raises up bad cholesterol. And as Bob Eccles said, he's the former president of the AHA, probably 10 years ago now, I follow his advice. If it raises LDL, that's all I need to know. It's not something you want to be eating on a regular basis. So I tell my patients that come in, I say, well, take that coconut oil and move it to the bathroom and take a nice soaking bath in it, and you can, soften your skin, but don't ingest it.
So there's enough. Go ahead. No, it was just another question in the chat was, how would you recommend getting your family and friends on board to make healthy changes together?
It's a good question. Excellent question. Well, you can set an example, and you're having a dinner party, or, some people over for supper, serve healthy food. Always serve, if you had a barbecue, always make sure there's lots of green vegetables and also a vegetarian choice there. I'm not saying that vegan meats are the healthiest thing, but you want to, maybe have some type of bean burgers. So sort of walk the walk and show people how healthy eating can actually, be easy to implement. And your budget, again, is, beans, canned low sodium beans, like $1 plus a can. It's very inexpensive, maybe $1.20. So there's 3 servings of beans. So if you have family members who have a sort of financial barrier to healthy eating, recommend some beans for them. And And there's lots of, if you go to the AHA website, you'll find lots of healthy recipes with plant proteins as well. So I would say, show them examples of healthy dinners and foods that are, plant-based and full of, greens and dark fruits and vegetables and whole grains.
I see JC Thomas has a question. He has his hand raised.
Yes, thank you. With this proliferation of the use of marijuana in various forms, does that have effect on heart health?
That's a good question. I have to say, I don't know the latest evidence, and maybe Dr. Yearwood does. I tell my patients the only thing that should enter their lungs is fresh air. So if you shouldn't smoke, anything, particularly cigarettes, but also marijuana, because smoke is smoke is smoke. We now know that, breathing in forest fire smoke can cause a heart attack. Breathing in air pollution that's smoky can cause heart attacks. So nothing that smoke should really enter the lungs. As far as the other forms of marijuana, like edibles, I don't know enough on the topic, and maybe Dr. Yearwood does, to tell my patients those are okay, because everyone's different. They may be taking it for a different reason. You may have someone who's terminally ill, or not. So I can't really sort of make the recommendation or not, but just don't smoke anything burning.
Yeah, I agree that we shouldn't be taking burning things into our lungs. It doesn't really make sense. I know some people are using it for other reasons. For chronic pain, sometimes nothing that seems to work. So I guess we have some people who get the marijuana for unbelievably chronic pain. And there are about 11 indications, according to the state of Rhode Island, for the use of marijuana, such as people with cancer and Crohn's, that kind of thing, and glaucoma. But so there are certain indications for using this, and because there are indications for a certain drug doesn't mean we should use that particular drug for all kinds of other things that aren't indicated, right? So, like, for example, if a beta blocker is used for hypertension, we can't just take it for fun and pleasure. They should be for certain specific reasons. But does it affect the heart? Specifically, I'm not aware of it either. But I think that if people are stressed out, they should probably get back to Christianity and to God and that would decrease
And
anxiety.
meditation. Yeah, and
That would decrease
meditation.
anxiety, wouldn't it?
Yeah, and meditation too. Yeah,
And meditation, absolutely. There's a disease, there's a broken heart syndrome, right? Takotsubo, which is definitely broken heart. We know that emotion can definitely affect the heart. So if you're stressed out, get back to the basics. Okay.
Very good advice, Dr. Yearwood.
There's another question in the chat that says, if your blood pressure is 140 over 90 without meds, should your primary care physician put you on meds?
Yes, based on the 2017 AHA guideline, evidence-based, that was based on the SPRINT trial, very large trial of maybe almost 10,000 individuals. And they looked at people that we said, okay, 140 over 90, that's okay, we won't put you on anything, versus people that they went ahead and put on blood pressure meds to drive them down to 120 over 80. And they found after follow-up, there was significantly reduced risk of cardiovascular events, particularly stroke outcomes and mini stroke and dementia. So I tell my patients, even though I'm a cardiologist, that, treating your blood pressure to 120 over 80 is really going to improve your brain health more probably than your heart health, but they're both important, but really the outcomes for brain events, cerebrovascular events are significantly reduced by going to that lower target. Now, if you're 130 over, say, 85, then your doctor has to do an additional step and do that risk score where you go ahead and put your information into the AHA risk calculator, and that's your gender, your age, your cholesterol, and your blood pressure, and whether you smoke. And then if you come out to be elevated risk, intermediate risk, I should say, not low risk, then you should also take a blood pressure medication if you're hanging out around 130 over 85. Now, one simple reading of an elevated blood pressure does not give a diagnosis of hypertension. So we were trained to try to get, 3 readings showing these abnormally elevated before we went ahead and commit someone to meds and to a diagnosis of hypertension. Now, if you tell your doctor, well, I've been drinking a lot of alcohol, I'm having work stress, I've been drinking a lot, you've gained weight, you're eating a salty foods, then maybe your doctor could give you a period of time to reverse those things and then come back to see if you still need the medication.
What do you tell people who say my blood pressure is perfect whenever I'm home, whenever I'm not in the office? Only when I see you.
I do like you, Dr. Yearwood. I roll my eyes. And I'm like, what is your blood pressure when you're out there on the road and someone cuts you off?
Right, that's right.
I don't know, you hear bad news in your face. If your blood pressure is spiking for the simple reason that you're at the doctor's office, then you probably have at least, early stage hypertension. So I generally, after I see this, I try to get people to recognize, hey, their blood pressure is spiking and we need to put you on something. There is an ambulatory blood pressure, cuff that you can wear, and you can then, see if your doctor can see if your blood pressure is spiking during the day when you're not in the office. So that's another option.
Dr. Asprey, I wonder if you could mention, we live in a world where it's so easy to access information on the internet, but the sites are not always medically accurate.
Yes.
You just say a little bit about what kind of like .gov versus .com kind of thing?
Right, that is so important, Rosemary. I tell all my patients, go to Google Scholar. Okay, it's only going to be science, peer-reviewed literature. It's the same as PubMed, and you're going to just be able to enter your search term. If you want to know about a topic like statins in women, do statins in women review, and you will find the science-based peer-reviewed literature, as opposed to just going on there and looking up, anything on just any web browser. This is so important because misinformation can lead you down the wrong path, particularly related to your health. So, and the same is true about certain foods. Again, certain diets, I don't want to pan any one diet, but we all know there's a diet out there that is tends to allow people to eat a lot of fat and have low carbohydrates. It's not evidence-based, but a lot of people feel, well, they lose a few pounds and they want to stay on it. And I tell them to do your research. There's some signals of harm, do your own studies, and not just go out to the internet, because anybody can post anything. And even if there's a doctor that's, promoting a certain supplement or diet, you've got to realize that unless it's peer reviewed by all his peers, then they may not be practicing in a mainstream medicine way. And one of the things about the American Heart Association is they really are only going to put out there evidence-based data, peer-reviewed, and they do most of the guidelines, and they're involved. Either they partner with other groups or they put out most of the guidelines in the cardiovascular health sphere. So you can also go on the AHA website, and they will tell you whether coconut oil is healthy or not, whether plant-based diets. There's a lot in that wonderful website, and I encourage everybody to go to heart.org, to the patient portal, and get all this evidence-based information and a lot more.
Well, there are no more questions in the chat. I don't know if anyone else has a question. Well, we want to thank you, Dr. Aspirin, for just an informative, quite an informative presentation. I mean, I, for one, have learned a lot, about cardiovascular disease, and I think what the takeaway is, there are so many things that we can do, as far as physical activity, changing our diet, to relieve some of the stress, but also to manage, if we are living with hypertension, to manage it. And so I just want to thank you for that. And I'm going to now introduce Rosemary O'Brien from Neighborhood Health Plan, Rhode Island. And I want to preface by saying this presentation, this conversation tonight was made possible through the support of Neighborhood Health Plan, Rhode Island. So Rosemary, it's all yours. Thank you.
Hi, everybody. I want to just say very briefly about Neighborhood. You may have heard, that we are a nonprofit health insurer located in Rhode Island. Right now, 1 in every 5 Rhode Islanders has Neighborhood. We have Medicaid plans. We have folks who can purchase insurance if they need to, but our main focus is to make sure that healthcare is affordable and accessible to everyone in Rhode Island. And to learn more about Neighborhood, you can go to nhpri.org. I also did want to thank Dr. Aspirin very much for your presentation tonight. I absolutely loved it and learned a lot as well. Thank you, Dr. Yearwood, for being here, and just thanking St. James for being willing to host us. And to get a lot of this good information out there. Hopefully you will share that with others as well. So thank you very much.
Thank you, everybody. And it was really an honor. Thank you, Albert and Andrea from the AHA, and Rosemary from Neighborhood, and really everybody, Dr. Yearwood as well, to speak. It's an important topic, and hopefully we reached some people here. Thank you all.
Thank you very much.
Thank you so much, everyone. Have a good day.
Thank you.
Thank you.
Take care. Bye-bye.
Thank you. Good night.
Bye.
Thank you so much, everyone.
Thank you.
Bye-bye. Thank you.